Fatima Muhammad's two sons are sick with malaria, but rather than go to the hospital, she's treating them at home because of fear of contracting the coronavirus.
I don't have money to take them to the hospital, and again, at the hospital, they'll easily call it coronavirus. I don't have money for that.
Malaria and COVID-19 present similar symptoms, but fear and stigma attached to the pandemic are reasons many like Fatima are seeking alternatives to hospital treatment. Experts say in-hospital visits for malaria have dropped significantly since the coronavirus was first reported in Nigeria in February 2020. A World Health Organization report said the pandemic is threatening years of progress made against malaria and warned that death rates could double. Disruption of preventive measures is to blame, says WHO consultant Linda Ozor.
The use of long-lasting insecticidal nets and seasonal malaria chemoprevention and prevention of malaria in pregnancy were interrupted. So assuming all these preventive interventions were interrupted, then it was expected, and the model showed that there will be a very negative effect.
Nigeria accounts for about a quarter of malaria cases worldwide and about 23% of deaths globally. Adeboyega Adeyogo, who heads pharmaceutical operations at a Nigerian company, says even before COVID-19 hit, many Nigerians took malaria less seriously.
Due to advances in health and technology, many people resolve malaria within days. So you see that many Nigerians now take it with a lot of levity because of the ease of treatment. But if they decide to avoid it, then it now becomes a major issue. And you now start seeing the more serious complications that are associated with malaria.
In 2020, Nigeria's malaria elimination program had plans to distribute mosquito nets, anti-malaria drugs and conduct free malaria testing to 31 million people. But disruptions caused by COVID-19 meant they reached only half of their goal. That has increased concern that malaria, along with COVID-19, will remain a threat to Nigerians for years to come. Timothy Obiezu for VOA News, Abuja.